morning, everyone. This is Dr. Amandeep, consultant neurologist at Mohali Hospital, Mohali. So, I will be talking about a very important topic, dementia. So, few important things about dementia. As we all know, dementia is a progressive deterioration, decline in the cognition, intellect, personality, behavior. So, this is a very common disease which we are encountering these days. This dementia can affect mostly causes affection of the elderly people in the age group of above 50 or 60 age group. But there are certain early causes of dementia also, which we call it as reversible dementia or reversible cognitive impairment, which we have to differentiate it from the degenerative disorders. So, due to any cause, if the patient is having any progressive deterioration of his intellect, cognition, planning, language, thinking, this collective syndrome will lead us to dementia. So, if we talk about the causes, there are some reversible causes of dementia, like in which, first of all, there are some deficiencies, vitamin deficiencies, B1, B6, B12, folate deficiency, which commonly causes this cognitive impairment. Then we have certain infections, HIV, AIDS, herpes, syphilis-like infections that can lead to these dementia and dementia-like disorders. Then we have certain cognitive related metabolic syndromes, like there are some metabolic causes like hypothyroidism, hyperparathyroidism, deficiencies of certain minerals and vitamins. Then certain minerals, toxins then lead us to this, like alcohol is very common. Other than this alcohol, we have some heavy metals like lead, mercury, which can lead to this dementia. Then there are some syndromes which are specific to this related to toxins, like alcohol-related syndromes are there. Machibawa-Bignami disease is there, in which there is cognitive impairment. Then we have certain chronic infections, subacute to chronic infections like CJD, and mumps and measles like viruses can also lead to this cognitive impairment. Once we are done, evaluated the patient and done with the reversible causes, which also includes the structural one also, like we have to do the CT-MRI for ruling out the structural causes for some space occupying lesions can also present with the cognitive dementia-like features. So after ruling out this, we then keep the possibility of progressive degenerative causes, in which we keep it as classified as cortical, subcortical, and subcortical dementias, which commonly includes the disorders like Alzheimer's disease, FTD, which we are encountering very commonly these days. So in Alzheimer's disease, the patient is having forgetfulness of recent events, forgetting his names, the tasks which he is doing day to day. The planning is affected. So later on, the patient will be having difficulty in doing day-to-day work, and language and other aspects and knowledge starts with the naming and forgetfulness of the recent. And similarly, there is another cortical dementia, most common we encounter as FTD, in which it starts with the behavior, language, and psychological and the personality issues are mainly there in these patients. So basically, the purpose of this discussion is any patient who is having these symptoms before the expected age, the patient is having dementia or cognitive impairment or forgetfulness issue before his expected age of around 70 to 80, he should get evaluated. So once the patient comes to us with this complaint, so we will look at the cause, the factors, whether it is dementia, cognitive impairment, MCI, or whether there is reversible cause or it is progressive degenerative cause. So evaluation is very important so that it is timely diagnosed and the treatment is started. Otherwise, the delay of treatment and diagnosis may lead to the patient's bedridden, being dependent in a very poor state. So take home message will be, if the patient or any friend or near dear one is having these similar symptoms, so you can contact us at Swana Hospital. Myself, Dr. Amandeep, and my team is available for evaluation of these dementia and forgetfulness disorders. Thank you.